products that you need in your office to help your pregnant patients with pelvic girdle pain. So we're talking any pain that's kind of going around the SI joint area. It can lead into low back, it can lead into that pubic symphysis, but we're specifically talking all about just structurally the pelvis today. So first product that you need is your foam roller. This product you definitely need for many different conditions in your office, but specifically for pelvic pain, we like to target the glutes. And so showing them how to get down comfortably, which I didn't do on my way down. So first things first, you're gonna get down on the floor. Knees are always gonna come together in unison, coming up together in unison as well. So when they're getting down onto the floor, just make sure knees and toes go together. So coming down into the glute or seated position on your foam roller, you're gonna be either doing rolling up and down onto one side of the glute. You can get them to cross their leg this way and rolling up and down. This feels amazing for that pelvic pain. Sometimes this can lead into that sciatica, so it's also really great. So leading into that positioning as well on that other side here. You can also get them to roll up and down their IT band because as you know, the TFL muscle goes into that IT band. So getting them to flip onto one side, one leg is gonna come up over top. You're gonna start right above the greater trochanter and do that TFL. And then you can get them to kind of walk their hands up as well to get all of that IT band. So the foam roller is something that we use in our office every single day when we're showing patients how to roll safely, especially if they are pregnant. So make sure you have one of these in your office. And again, when you're getting up off that floor, both hands come into that tabletop position and then come all the way back up. So next product you need is you're going to have an SI belt. Either have one extra. So we always have about 3 or 4 in our office in case of emergencies if our patients need to take one home before they can get one themselves. So having one of these in your office is key because when you're putting it on nice and low here, I'm just going to check the mirror. So nice and low with that sacrum, buckling it up with them nice and tight underneath that belly, right around that pubic bone, and then getting them to stretch and strengthen, or stretch it so it's nice and tight and secure. This provides a lot of compression and can keep everything nice and tight for them as they're going around, walking around, doing their daily activities, because this just provides that extra support. For second kiddo, it can also be really, really nice because the mom's carrying, picking up their toddler a whole bunch of times throughout the day, which means that sometimes they can be a little bit more unstable with their pelvis with second pregnancy because your body already knows what to do. So having one of these in your office for extra is amazing because then you can show them how to use it. Lastly, what we are going to do is go over our bands that we always have in office. So as well as weakness and loosening with the pelvic girdle, we need to also strengthen the glutes. So having these in your office is really nice because you can show patients how to use it. So getting them to put it on just above their knees. This little packet comes with a couple different strengthenings. So you can use extra heavy, you can use heavy. This one is light. And then I think there's an extra light one as well, but it comes with the different options for your patients so they can use it whatever they want to. So what we like to do in our office is strengthen the glutes. So you're gonna come down into that squat. You can do regular squats, just making sure that the knees are coming out nice and wide. You can also get them to come down and lead with that knee as they're going side to side here. This is gonna help strengthen the glutes, strengthen the pelvic girdle, so it's gonna be less wobbly for them and they can feel more secure in that area with that pain that they're going through. For more questions or comments, you can leave them in the comments section, and of course subscribe to our YouTube channel.